Papua New Guinea's Prime Minister has defended a proposal to give millions of dollars to a newly formed company that thinks it's found a new COVID-19 treatment. While the Health Minister says the funding submission was approved, James Marape says the process of engaging the company is not yet complete. PNG correspondent Nat Whiting says the company is apparently highly confident in its findings.
Well, the details, Yvonne, have come out via a leaked cabinet document that detailed that money was going to be given to this newly formed company called New Guinea Biomed. Now, the company's made up largely of researchers from the University of Papua New Guinea, and they say that they have been doing a sort of desktop analysis, scanning and analysing, they say, 30,000 drugs from across the world. And they say that through their analysis, they've been able to work out 10 of these drugs that they think will work well against COVID-19. And so they want to get this funding to purchase the drugs, they say, and attempt a new combination therapy.
How was this money awarded? Do we know what processes were in place?
It's not entirely clear. We know that this group did make some presentations to the Prime Minister and to other members of his cabinet. The Health Minister told us that the funding had been approved. The Prime Minister has since come out and said that the process of engaging this company isn't yet finalised. So it's not entirely clear as to whether this money has been officially awarded or not. The money, as I said, is meant to be used for purchasing drugs and then running clinical trials. But again, we don't have a lot of detail around how these trials will be run or what exactly is planned.
And Nat, what's been the reaction to the announcement?
Look, there has been some concern within Papua New Guinea, including within the broader medical research team. The head of the Institute for Medical Research within Papua New Guinea has raised concerns, saying that his institute isn't involved and hasn't been approached with the details of this proposal. We also asked the representative of the World Health Organization in country, who said that he wasn't aware of the details either. There's also concerns from people around money being allocated to this, obviously at a time that is economically difficult for PNG. The company says that they are highly confident of this working. They think that they're onto something and that this combination drug therapy could be a potential cure, they say, for COVID-19. Here's one of the company members speaking on that.
Nations and pharmaceutical companies are pumping in hundreds of millions, even billions of dollars to find the cure. And for us, I can tell you how we found the cure: God. We believe in God. And God has a plan for this nation. That is why, even though the facilities are run down, God was able to give us this revelation into discovering this cure.
And Nat, where is COVID at in Papua New Guinea at the moment? What are testing numbers like?
So the testing rates are still relatively low. They're sitting just over 29,000. So far, they've confirmed almost 590 cases within the country, and the deaths is still sitting at only 7 recorded deaths. Now, it's thought that there likely is more cases that haven't been picked up, but we haven't been seeing mass deaths or hospitals being overrun. It's thought potentially the country's generally young population may be helping with there being more asymptomatic cases or perhaps less serious cases at this stage. But obviously it is still early days in terms of case numbers and the outbreak within PNG. And there are concerns around ensuring that the testing is increased, that PPE is available, lots of these sort of basic issues, which is what a lot of Papua New Guineans are saying we should be focusing on, as opposed to giving money to this new company to look at a potential new treatment.
Natalie Whiting, thanks for that update.